Why does your pain management doctor prescribe you addictive opioids and stomach-destroying ibuprofen, when he knows there is a liquid that stops pain instantly without a single side effect? He does it because a patient in pain is a customer for life, while a healed patient is a lost revenue stream for the pharmaceutical cartel. They want you to believe that your arthritis, back pain, and old injuries are permanent sentences of suffering that you must manage until you die. They want you to accept that the only way to silence the screaming nerves in your body is to numb your brain or cut your nerves with a scalpel. This is a medical suppression campaign designed to hide a substance so powerful that it threatened to bankrupt the aspirin industry in the 1960s. Your pain is not a deficiency of Tylenol. It is a blockage of flow and a hypoxic crisis in your tissues that prevents healing. The medical industry calls this chronic inflammation, but they treat it by poisoning your liver with NSAIDs that kill 16,000 people every year. When you take their pills, you are just turning off the fire alarm while the house continues to burn down around you. I am going to show you how to extinguish the fire, repair the tissue, and vanish the pain using a forgotten industrial solvent derived from trees. We are going to use a clear, odorless liquid that penetrates human skin faster than water and carries healing directly to the bone. No addictive narcotics, no ulcers in your stomach, and no fear of the weather changing because your joints hurt. To understand the cure, you must understand the history of the most controversial molecule in medical history: dimethyl sulfoxide, or DMSO. DMSO is a natural byproduct of the wood pulp industry. It is literally the lifeblood of trees, processed into a clear liquid. In the 1960s, doctors discovered that this liquid could pass through skin, membranes, and cell walls, as if they weren't even there. It acted as a master carrier, dragging anything it touched deep into the body, and it had a miraculous side effect. It stopped pain on contact. It blocked the C fibers of the nervous system, the tiny wires that send pain signals to the brain, acting like a non-toxic anesthesia. It reduced swelling in minutes, not days, by flushing out the inflammatory fluids and increasing blood flow to the injury by 400%. It was hailed as the aspirin of the 21st century, and researchers believed it would revolutionize medicine forever. But there was one big problem. DMSO is a natural product that is cheap to make and impossible to patent. The pharmaceutical companies realized they couldn't make billions off a wood byproduct, so they lobbied the FDA to ban it for medical use. They buried the research, demonized the substance, and left millions of people to suffer in pain so they could sell their patented pills. Your doctor ignores DMSO because he was never taught about it in medical school, or he fears the stigma of prescribing a horse liniment. You do not need a prescription. You need a solvent that dissolves the inflammation and delivers oxygen to the starving cells. DMSO works by neutralizing the most dangerous free radical in your body, the hydroxyl radical, which destroys your joints. It grabs this radical and converts it into water, stopping the destruction of your cartilage instantly. It acts as a cryoprotectant, protecting your cells from freezing and dying, which is why it is used to preserve organs for transplant. If it can save a heart in a cooler, imagine what it can do for your stiff, aching knees or your frozen shoulder. We have seen arthritis patients who couldn't hold a coffee cup regain full grip strength after just 1 week of topical application. We have seen athletes with sprained ankles run marathons days later because the DMSO accelerated the healing process by triple speed. But you must use it correctly, or you will experience the garlic side effect that scares people away. When DMSO metabolizes in your body, it turns into DMS, dimethyl sulfide, which has a distinct oyster or garlic smell. You might taste garlic in your mouth seconds after rubbing it on your foot. That is how fast it travels through your system. This smell is a small price to pay for total pain relief, but it is the reason the cosmetic industry hates it. To use DMSO safely, you must buy pharmaceutical grade, 99.9% pure, liquid or gel, never the industrial grade sold at hardware stores. Industrial grade contains impurities, and because DMSO is a carrier, it will drag those impurities straight into your blood. You must also apply it to surgically clean skin. Wash your hands and the pain site thoroughly before touching the bottle. If you have dirt, lotion, or chemicals on your skin, The DMSO will take them inside with it, which can cause irritation. You start with a 70-30 mix, 70% DMSO and 30% distilled water or aloe vera gel to reduce the stinging sensation. Pure DMSO releases heat when it touches water, so it can feel hot and itchy on the skin for the first few minutes. Rub it gently onto the painful joint or muscle and let it dry completely for 20 minutes before putting on clothes. Do not cover it with plastic wrap or tight bandages, as the heat can build up and cause a chemical burn. But DMSO is not just a painkiller, it is a Trojan horse that can carry other healing agents into the joint. You can mix crushed magnesium tablets or magnesium oil into the DMSO to drive the mineral directly into the calcified tissue. Magnesium relaxes the muscles and dissolves the calcium spurs that are causing the sharp, stabbing pain. You can mix it with capsaicin from chili peppers to deplete the substance P pain neurotransmitter even faster. This combination creates a synergistic rescue that attacks the pain from chemical, electrical, and structural angles simultaneously. But the most shocking benefit of DMSO is its ability to heal scar tissue and old fibrosis deep inside the body. It dissolves the collagen crosslinks that make scars hard and restrictive, turning old, stiff tissue back into flexible skin. It works on internal scars too, helping to resolve adhesions after surgery that cause chronic pulling and pain. It treats scleroderma, a condition where the skin turns to stone, by softening the collagen matrix. Your doctor will warn you that DMSO can affect your vision, citing a flawed study on dogs from the 1960s. This study used massive doses that no human would ever take, and subsequent human studies found no damage to the eyes at all. In fact, DMSO is used to treat interstitial cystitis, bladder pain, and is FDA approved for that one specific condition. If it is safe enough to put inside a human bladder, it is safe enough to put on your knee. They keep it in a bladder cage to prevent you from knowing it works for everything else. You must also stop eating the inflammatory fire that is fueling your pain while you use the solvent. Nightshade vegetables like tomatoes, potatoes, and peppers contain solanine, a toxin that triggers joint pain in many people. Seed oils, canola, corn, soy, are liquid inflammation that settles in your joints and oxidizes. You cannot put the fire out with DMSO if you are pouring gasoline on it with every meal. Switch to an anti-inflammatory diet rich in omega-3s and sulfur, eggs, onions, garlic, to support the repair. Sulfur is the mineral of beauty and structure. DMSO provides a massive dose of bioavailable sulfur to rebuild your joints. You will notice your hair and nails growing faster and stronger as a side effect of the extra sulfur. You will notice your skin glowing as the blood flow improves to the surface capillaries. The reverse doctrine is about using the tools that nature provided before patents existed. The tree does not patent its sap, it gives it freely to heal its own wounds. You are borrowing the healing power of the forest to fix the wounds of your modern life. Do not let them drug you into a stupor while your body cries out for repair. Do not let them cut you open to scrape away bone when you can dissolve the inflammation. The solution is in the clear liquid, the clean skin, and the garlic smell. Penetrate the barrier, block the nerve, and heal the cell. This is the reversal of the chronic pain curse, and we do not manage the suffering, we delete it.